Shingles, a condition caused by the reactivation of the varicella-zoster virus, often affects individuals over 50 due to natural immune decline. Shingles symptoms vary but can lead to severe pain, nerve damage, and, in some cases, long-term complications like postherpetic neuralgia. This in-depth video guide covers the 5 primary signs of shingles, enriched with case studies to provide a clearer picture of what shingles might feel and look like for those affected. Sign 1. Pain, tingling, or numbness. One of the earliest warning signs of shingles is localized pain, tingling, or numbness, typically affecting one side of the body. This sensation can be deceiving, as it might initially feel like a pulled muscle, bruised skin, or an area of heightened sensitivity without any visible signs. Case study. Sarah's story. Sarah, a 54-year-old teacher, began feeling a strange tingling in her lower back and hip. Initially, she thought she had strained a muscle or slept awkwardly. However, over a few days, the tingling evolved into a sharper, more stabbing pain localized to her left side. Concerned, she visited her doctor, who recognized the signs and diagnosed her with early-stage shingles. Because she sought help at this initial stage, Sarah was prescribed antiviral medication, which significantly reduced the severity of her outbreak. Sarah's case highlights the importance of recognizing early nerve-related pain and acting on it. This nerve pain, known as prodromal pain, often begins days to weeks before any visible signs appear. In some cases, this phase can last long enough that patients dismiss it as minor. This pain stems from the virus traveling along nerve pathways, causing inflammation. For some, this stage is the only chance to recognize the onset before the more painful and visible symptoms appear. Sign 2. Red rash following the pain or tingling phase. A distinctive red rash usually appears, signaling the progression of the virus. The rash typically shows up in the same area where the initial pain or tingling was felt. It appears in a specific band-like pattern, usually wrapping around one side of the torso, chest, or face, depending on the nerve affected. Case study. Tom's story. Tom, a 63-year-old retired engineer, experienced sharp pain in his right shoulder blade that he thought was due to gardening. Days later, he noticed small, red, clustered bumps in the same area, which grew in size and spread down to his upper arm. Concerned, Tom visited his doctor and learned it was shingles. Because Tom was still within the early stages, his doctor started him on an antiviral treatment, which helped reduce the symptoms' duration. Tom's case demonstrates how shingles can often be mistaken for something else, especially if initial symptoms are vague. Rashes associated with shingles start as small, red spots that may look like a typical skin irritation. However, unlike other skin rashes, shingles develop in a cluster and typically follow a nerve line. These rashes are distinctive due to their pattern, which can help differentiate them from other skin conditions like eczema or an allergic reaction. Sign 3. Sensitivity to touch. A third common sign is heightened skin sensitivity, especially in the area where the rash is forming. Even the lightest touch, such as brushing clothing or a cool breeze, can cause intense discomfort. This sensitivity can make daily routines challenging, as ordinary sensations become painful. Case study. Janet's story. Janet, a 59-year-old avid gardener, began feeling a strange sensitivity on her right abdomen. When wearing her usual clothing, she noticed it felt uncomfortable and sometimes painful, as if her skin were bruised. As days passed, her sensitivity worsened, making even soft clothing uncomfortable. After a few more days, a red rash began to appear. Janet's doctor quickly recognized her symptoms as shingles. Her case illustrates how unusual sensitivity, especially in a specific area, can be a crucial early warning sign of shingles. This hypersensitivity is due to inflammation along the nerves, which can make even minor sensations feel painful. The affected skin may feel tender, and in many cases, this sensitivity can persist beyond the shingles rash, leading to chronic nerve pain. Sign 4. Itching and skin irritation. Intense itching or skin irritation in the affected area is another common symptom. The itch can be more than just uncomfortable, often leading to a persistent urge to scratch, which can worsen the skin's condition, leading to potential infections or complications. Case study. Robert's story. Robert, a 62-year-old retired mechanic, initially noticed a persistent itch on his upper left chest. He He dismissed it as a mild skin reaction but found himself scratching the area repeatedly over a few days. Soon, a red rash began to emerge in the same location. After consulting his doctor, he learned he had shingles. The itching continued even after the rash healed, reminding him to stay cautious of unusual sensations. Robert's experience shows that even something as simple as an itch, if persistent, can be an early indicator of shingles. This itch results from nerve irritation rather than the rash itself, making it feel more intense than other skin itches. As the condition progresses, itching may be accompanied by pain, sensitivity, and irritation, combining to create significant discomfort. Sign 5. Fever and fatigue. As the body's immune system fights the virus, fever and fatigue often accompany the other symptoms. While not always present, these systemic symptoms can make shingles feel like the onset of a viral illness or mild flu. Case study. Lily's story. Lily, a 67-year-old retiree, noticed she felt unusually tired and mildly feverish over a few days. She thought it was just a passing bug or fatigue from a busy week. Around the same time, she noticed a sharp pain in her left shoulder blade, which eventually developed into a rash. Her doctor informed her that her fever and tiredness were likely due to shingles. Lily's story demonstrates that systemic symptoms, though easy to overlook, may accompany shingles and can provide additional clues to the diagnosis. Fever and fatigue are signs of the body's immune response working to contain the virus. If these symptoms occur with the other signs, particularly pain, rash, or sensitivity, it's a strong indication that shingles may be the cause. Seeking medical guidance at this stage can help in managing the condition before it escalates. Understanding shingles complications and treatment options. If you think you're experiencing signs of shingles, it's essential to seek medical advice as early treatment can significantly impact the course and severity of the condition. Antiviral medications such as acyclovir, famciclovir, or valacyclovir are often prescribed to shorten the duration of symptoms and reduce the likelihood of complications. Pain relievers and topical treatments may also be recommended to manage discomfort. In some cases, particularly for older adults, complications like postherpetic neuralgia, PHN, can occur, resulting in persistent nerve pain even after the rash clears. Vaccination, such as the Shingrix vaccine, is an effective preventive measure, reducing the risk of both shingles and long-term complications for those over 50. Recognizing the signs of shingles, particularly the early symptoms, can make a significant difference in outcomes, especially for older adults. If you experience any unusual pain, skin sensitivity, rashes, or fatigue, consulting a healthcare provider can help confirm whether it's shingles and enable you to start treatment sooner, reducing the risk of complications. Medical disclaimer. This script is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor or another qualified healthcare provider with any questions regarding a medical condition. Never disregard medical advice or delay seeking it based on information from this script. For more health insights and tips, remember to subscribe, and until next time, take care of your health.